Welcome guys to Mwalimu Visual Channel, and today we want to look at medical effects of alcoholism. As you can see, we have a doctor in the house, very beautiful lady called Dr. Wanjiru. Yes, welcome to the show. And after this we're going to look at, we're going to understand when you take a lot of alcohol, when you're indulging a lot in alcoholism, what's some of the effects to your body? How can you affect your body with it? So welcome.
Thank you.
Yes.
So my name is Wanjiru Muturi.
Okay.
I am a clinician.
Yeah.
I am a content creator. And also I am a mental health awareness advocate.
Okay.
So I advocate a lot about mental illness and how to go around all of those.
Okay. You're a content creator.
Yes, I am a content creator. I have a channel, Wanjiru Muturi. I am a TikToker, Wanjiru Muturi, across all of them.
Okay.
You can find me there.
We must.
Thank you.
Yes.
Thank you.
Yeah.
So,
okay.
Today you asked me to come and talk to your people about alcoholism.
Yes.
And the medical effects that come with alcoholism.
First, before you go to the negative, I know you're going to the negative. Can you start with the positive?
Of course, everything has a
positive medical effects of indulging to alcohol.
I will not say positive medical, okay? Unless we're talking about anesthesia, unless you are in so much pain and you do not have local anesthesia that napiga shot ya whiskey.
Okay.
Piga hii tumalize kenye tunafanya. You get? But don't come for me about okay?
Yeah, okay.
But apart from medical, sherehe ni sheria, si ndio? Lazima watu wapige sherehe, si ndio?
Lazima?
Occasionally, piga sherehe.
Okay.
Jibambe. If you need alcohol, just take it responsibly and take it occasionally. Sawa.
Yes.
So the effects will come with long-term use of alcohol.
You're talking about alcohol, yeah?
Yes.
So are you talking about even the local liquor or changa, busan, beer, all that?
Yes, I am talking about something with alcohol content.
Okay.
Sawa.
Yes.
From 4% to 50 something.
To 100.
Yeah, kuna ile nasikia iko 90 kedo.
Yes, changa,
you people are trying, bwana. But anyway, so alcoholism, first to define it, is a consumption of alcohol or the urge to take alcohol to be able to cope with things that you're supposed to cope with even without the alcohol. Okay. And also taking it in large quantities. And very, very regularly.
Okay.
Yes, but the fact that you will not be able to do without it is a key. This is a key word. The urge to always want to take the alcohol.
That urge, you are craving for it.
That is the word I was looking for. Craving for alcohol every time to be able to deal with our day-to-day lives. So that is alcoholism.
Yes.
Okay. So to the effects, we go to the major effect of alcohol. The liver damage. Okay.
Yes.
The liver is the one that is in charge of breaking down the alcohol that you take. So every sip of alcohol you take has to go through the liver for breaking down. Okay. So the liver will be the first culprit. It will also affect your brain. Yes.
So tumetoka liver tumeenda kwa brain.
Tumeenda kwa brain. Okay. Kwa brain, especially the young people. Sawa. Especially the teenagers whose brains are growing are the people at the highest risk of getting brain damage due to alcohol and drugs than already developed brains. Okay? Because you tend to damage the cells, the brain cells that are forming, that are currently being formed. Okay. So they tend to, hata ukiangalia in our communities, the younger people, even when using drugs, wao ndo wana chizi. You rarely will you actually never will you ever see 30-something year old or a 40-something year old amevuta bangi akachizi ama alcohol akachizi sawa because their brain cells were already grown. Sawa. So when you are an alcoholic, you started early and you continue like that, you're at a risk of getting memory loss. You are at a risk of getting coordination problems. You are at a risk of getting dementia, which is long-term memory loss. Okay?
Okay.
Yes.
Oh, thank you. So,
the other thing is heart problems, so the cardiovascular issues.
Brain now from the liver, brain, now we are at
we go to the heart. We deal with the major organs. You realize these are the vital organs. These are your vital organs. These are the organs you cannot live without. You cannot do anything without. When you get the multiple organ failure, you're done.
You're done, yes.
Okay?
Yeah.
That is the brain, the kidney, the heart, and the liver. Sawa sawa.
Yes.
So right now tuko kwa heart.
Yes.
So what happens kwa heart, the alcohol ikikuwa mingi sana, it causes vasoconstriction. Your two veins zinakuwa kidogo. So you are at a higher risk of getting high blood pressure.
Yes.
That's leading to a stroke.
Yeah.
That's leading to maybe congestive cardiac failure. Sawa sawa.
Yes.
So hizi ni vitu zinakuja just by taking a lot of alcohol. The other organ that can be affected by alcoholism is the kidney.
Yes.
Okay.
Yeah.
Remember, alcohol is a diuretic. A diuretic is something that is introduced to your body to take away water.
Yes.
So when you take a diuretic, you tend to go to the toilet for short calls quite often. Which is what alcohol will give you. So you will tend to go and pee a lot of times. Okay, so you'll get dehydrated. You're at a higher risk of getting kidney problems. Okay? Yes. With severe dehydration will cause kidney failure, acute kidney injury. Okay? Yes. And then we go to the next effect is pancreatitis. Pancreatitis is the inflammation of the pancreas.
So you're at the pancreas.
Yes.
Okay.
Now the pancreas produces insulin. Insulin breaks down glucose. So what you take mostly will be converted into glucose. So insulin will break it down to the form that the body will be able to excrete. So when you have pancreatitis, you are at a risk of inadequate insulin, which will lead to diabetes. Okay, so the pancreatitis is a short-term effect, and then the long-term effect is diabetes. The other effect is on the skin.
The skin.
Yes. The skin is it is actually the biggest organ in our body, right? Yes. And the skin thrives on water and nutrients. For you to glow, you need water. Okay, you need to be hydrated, and you need a lot of nutrients to come mpaka ifike kwa skin.
Kwa skin, yes.
Yes.
Okay.
So what did we say alcohol does? It constricts your vessels so that oxygen and nutrients will not be able to fika to the end organs kabisa for you to get the nourishment it needs. Okay. So you are at a risk of getting bad skin damage, dry skin, stretchy skin, okay? Hizo zote. Prolonged use of alcohol will tend to give you mental problems, okay? Ama will predispose you to getting mental illnesses like depression and anxiety. Sometimes they will come together. So you'll find someone has a continued low mood, which is depression, without being able to lift themselves up until atumie alcohol. Also, you'll get someone akipatwa na something small, like a small financial constraint, anakuwa anxious for the longest time, until aende atumie alcohol so that he can be able to cope with that very small issue, a day-to-day life issue.
So you're talking about those guys who are ever sad when they have not taken alcohol?
Yes. And you'll find it is alcohol that was a trigger to the depression. Yes, because some of these mental illnesses will just need a trigger. They need a trigger for you to come up into maybe depression or anxiety. Yes.
So that's why some guys say that you have to take some people for them to talk.
Yes, for them to get confidence. They have to. So it has affected your esteem, your mental health. So you need the alcohol constantly for you to be able to cope with their day-to-day lives.
We are continuing the conversation about the medical effects of alcoholism. Yes. So we are talking about mental health. before the break.
Yes.
So what is the other effect you can
So the other effect of alcoholism is healing.
Healing.
Yes.
Yeah.
Healing, because alcoholism will tend to first suppress your immunity. Okay. Yeah. And then the other thing, it will compromise the wound healing, especially process.
Okay.
How? For healing to take place, there needs to be nutrients like vitamin A, vitamin B6, and vitamin C. Okay. Yeah. Which these nutrients tend to be inhibited by the uptake of alcohol. Alcohol inafanya hizi nutrients zisifikie, especially kama kuna wound mahali. Sawa sawa?
Yes.
And tuliongea kuhusu constriction of vessels that making nutrients zingine zisipite na oxygen, which is very vital in healing process.
Yeah.
Sawa sawa? So you tend to have people wakiwa na injury na ni alcoholic, anakuwa na kidonda yenye ingepona within 1 week, alafu ina take more than 2 to 3 months. Okay? Yes. So it delays the healing process, which is not good for your health.
What is the advice you can give as a doctor now, and you've been in this profession for long? What can you advise people about alcoholism? Yes.
I will advise for people to weigh the cons and the pros. Okay? Yes. Because clearly we've taken more time to talk about the cons than the pros. The good things are not very many. Okay?
Yes.
Isipokuwa sherehe, what else really? Okay. So what you do is that if you have to take alcohol, take it responsibly. You know, there are so many issues that come from alcoholism.
How about those people who take alcohol to solve the issues?
I prefer for people to embrace seeking help. Because help does not come from a bottle. Help will not come from a bottle. You need to seek help from...
Well, Doctor, there's a time you are really stressed and you really need one.
You need a support system that does not come from a bottle. Okay? We are here for you. We guys in the hospital are always... Sengine tunakulanga mzizi tu uko tumewangoja, by the way. The men are very nice because they come and tell you, nastaki wewe, you are too young for me. Okay? Just come and give your specifications of what you want. We will give you someone. We always have someone who can talk to you. Okay? The cons are too many. There are things like cancer.
Yeah.
Okay?
Yes.
The body, when you take a lot of alcohol, you tend to have a risk of getting so many cancer. The throat cancer, okay? The stomach cancer, so many things. The stomach, getting ulcers. You know, we have a lot of those, especially with the men, okay? Because they take alcohol without eating.
Yeah, without eating. Yes.
They forget to eat fast. So they'll come to the hospital, already bado ako na njaa. He has not taken anything, but he has already taken the alcohol. So what we are dealing with here is chronic gastritis. Okay? So many things will come from alcohol uptake. Okay? So just weigh and make a decision for yourself.
So thanks. That's the last word from Dr. here, that weigh and make a decision. As I made a decision.
Yes.
To just avoid it and have a sober life.
Yeah.
Yeah. Thanks so much for coming. Will you be here again?
Yeah, thank you for having me. I'll be here again.
Okay.
Yes,
thank
anytime.
So hey, what's the name of your channel?
Wanjiru Muturi. Go to that channel, subscribe, say something, tukigrow.
Yeah.
Tumekuama. Tuache kukwama.
Asante sana.
You're welcome.